Now we turn our attention to Dr. Kevin Cavanaugh, retired physician, founder of Health Watch USA. Dr. K, good morning.
Good morning, Jack.
How are you today?
Doing really good this morning.
Good. I guess we'll start with the government's deal for COVID-19 treatments with Eli Lilly.
Well, yes, and we had a question last week regarding the cost, and it should be noted that the government does cover and will pay for the cost of the drug itself, but unfortunately, there can still be a fairly hefty cost of administration. According to NPR, it can cost over $1,000 to get the drug administered. That should be paid for by your insurance company or Medicare, but of course, you'd still be responsible for the copay or the deductible. But I cannot stress more that if you are at high risk for COVID and just got back a positive test, you should be calling your doctor in order to get these monoclonal antibody drugs or to see if it's indicated to give them to you. In addition, to locate an infusion center or where to get them, you can go to the Department of Health and Human Services website. That's at combatcovid.hhs.gov and click on the Find Infusion Location screen button and you can locate a center. So that is something you need to keep in mind. They've only administered approximately 40% of the available doses, and this is nationwide now. So there's a lot of this drug out there. President Trump's had it, Rudy Giuliani has had it, so is Chris Christie. This drug is the only one which is approved to prevent severe COVID-19.
Now, there was a question that came up last week, and I knew when it was asked that you would do your homework on it about medication called, is it ivermectin?
Yes, and ivermectin is a promising drug. It does look like it works in the lab. The FDA, however, has not either approved or disapproved of this drug. They said that there's insufficient data. The concern is that although it is looking promising in the lab, they are not sure that you'll be able to obtain a high enough drug concentration in the body's tissues to duplicate these good results. So they really don't know which way to go, but that is a drug to follow. And I imagine at some point there might be a randomized controlled trial looking at its effectiveness.
We're visiting with Dr. Kevin Cavanaugh and talking about the coronavirus. Tell us about the coronavirus study, I guess, that has found that the infection provides some immunity for at least 5 months. Is that right?
Well, yes, and that is good news, but it's also a reason to get the vaccine because some immunity is approximately 83% protection against reinfection of either mild or severe COVID over the first 5 months. Now, that's just 5 months and it's just 83%. Remember, these vaccines are 95% effective and they expect them to last at least a year. And that's been out of some data that was provided by Moderna. So you do want to get the vaccine. However, infections do provide some protection on the front end.
Dr. Kevin Cavanaugh, always a pleasure to talk to you, sir, and we will meet up with you on Wednesday.
Okay, thank you very much, Jack.